leading gynecologist from India, talks about her education and experience. She has been awarded by the National Academy of Medical Sciences with the Best Scientist Research Award.
I basically specialize in gynaecological surgery. I've done my studies from Medical College, Amritsar. I passed out my MBBS in 1986 and I'm in practice for the past from 1994 onwards. I can just talk about my research. I got the Best Scientist Research Award from the National Academy of Medical Sciences on the polycystic ovarian disease, syndromic annuity. And I have been doing endoscopic work for the past about now 15 years, looking into the various kinds of fibroids, myomectomies, hysterectomies, and published papers. And also been awarded the fellowship for the Indian Association of Obs and Gynaecology and facilitated with that in the last year in Amritsar. The major procedures which I have successfully done is hysterectomies in even big or small fibroids or big size uteri. That doesn't make a difference to me. I have been quite professionally okay by operating laparoscopically with big small fibroids, number one. In big size uteri, myomectomies of any size, big or small fibers, I can remove them myomectically safely and also suture them. Ovarian cysts, big and small. And also try to do laparoscopic Vardhans, cancer surgery, cancer cervix surgery. So I'm good at even that. The uterine artery embolization would be a procedure, would be a preferred procedure internationally as of date in patients who are not of the reproductive age group. Now that is the main issue because it causes radiation, and as any of the radiation procedures, we or the women normally do not or would not like to have the side effect of an ovarian failure because of that particular overablation. Under control, that is quite fine, but still, there are reports where it is a debate going on for reproductive age group patients. Otherwise, it's a good procedure in perimenopausal age group where the patients are having menorrhagias, they have already completed their families, and it is a fibroid which, as a first invasion, we can always do a uterine artery embolization, try to see if the symptoms are cured. If that is cured, she is asymptomatic, the size of the fibroid shrinks, she goes into natural menopause, which is a part of a radiation process, and maybe it may come up earlier. It's suitable because we can avoid a surgery when it is minimally invasive. But if they do not rectify, fair enough, we have the second choice always there, the surgeries always can be offered. I would put it that way. So that should be a good option for these patients who have completed their families. And I'm looking at patients who yet to complete their families. There, of course, I feel that the fibroid should be removed and sutured as it is conventionally being done, not by an open method now, but a laparoscopic method. The patient conceives well, delivers well, there's no problem after that. Recurrences are always there. After the completion of family, the second choice is always available if at all. Normally my patients are from Nigeria. We have the state-of-art equipment out here with all the gadgets are available. I mean, the high definition camera is there. We have got the harmonic. We have the magical knife. So it makes life very, very comfortable operating laparoscopically in all these major surgeries because the patient is up and about in 2 to 3 days time. There's less of hospital stay. The patient is normal on her normal diet in about 3 days from now, which is quite a miracle as far as the whole revolutionary gynae surgery is concerned, as compared to the older times which are long cuts on the abdomen and the patient's recovery time used to be much longer. So that's quite a boon, I feel. And normally total laparoscopic hysterectomies I have done in ample number, maybe more than a century now, in the past 6 months in this hospital only. And coming to, of course, the ovarian cysts, the ectopics, not mentioning on that, would be a couple of them. They are all on my website, as I said, and I have videos on the same. So any patient who is requiring any kind of help on that, the ready demonstration of that particular procedure is also available on my laptop all the time, 24/7.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.